All right, today we're going to talk about a truly elegant system, a method that medical professionals use to bring order to the absolute chaos of an emergency. It's a system designed to save lives by focusing on one simple thing: what matters most right now.
Just picture it for a second. You've got a critically ill patient, a whole storm of confusing symptoms, machines are beeping everywhere, and you're on the clock. The pressure is just immense.
And here's the real challenge. You have to act immediately, but you don't have the luxury of a diagnosis. You don't know what's going on yet. So where on earth do you even start?
Well, the answer is this incredibly powerful, yet surprisingly simple checklist. It's called the ABCDE approach, and it's basically a framework that lets any clinician walk into that chaos and systematically find and fix the things that are going to kill the patient first. So let's dive in.
Everything, and I mean everything, starts with A. A for airway. And the reason is simple. If air can't get into the body, nothing else we do is going to matter one bit. This is priority number one always.
Now, what's so smart about this is how the approach immediately adapts to the situation. For most patients, a simple head tilt and chin lift is all it takes to open that airway. But if there's even a hint of a neck injury, they switch to a different technique called the jaw thrust. This gets the airway open without moving the spine. It's a really critical distinction.
Of course, sometimes just opening the airway isn't enough. For patients who can't protect their own airway or breathe for themselves, the team performs a procedure called rapid sequence intubation, or RSI, and it's like this highly choreographed dance. You can see the 6 key steps here, all designed to take definitive control of that airway as quickly and as safely as humanly possible.
Okay, so let's move on to B and see how this all builds. Once we know the airway is open, the next question is the body actually using it? Is the patient breathing effectively? Is that precious oxygen actually getting into the blood?
And this is where things get a little counterintuitive. You'd think, just crank up the oxygen, right? More is always better. But nope. Turns out, for patients with certain chronic lung diseases like COPD, too much oxygen can actually be dangerous. It can switch off their body's natural drive to breathe. So you see, while they shoot for 94 to 98% for most people, they carefully aim for a lower target in that specific group. It's tailored medicine in action.
While they're assessing breathing, the team is also on the hunt for these immediate killers. I'm talking about things like a tension pneumothorax. That's a collapsed lung that traps air and literally starts crushing the heart. Or a massive hemothorax, where the chest is just filling up with blood. And as you can see, each of these has a specific, immediate fix that has to be done on the spot. No hesitation.
All right, so air is getting in, oxygen is moving to the lungs. So what's next? Well, now we have to make sure that oxygen-rich blood is actually getting pumped around the body to all the vital organs. And that brings us to C, circulation.
When it comes to circulation, the biggest, baddest wolf at the door is a state called shock. And all shock really is a crisis where the body's organs simply aren't getting enough blood flow to stay alive.
The incredible thing is, you don't need a fancy CAT scan to spot it. Clinicians are looking for these classic telltale signs. The blood pressure starts to drop, the heart rate skyrockets to try and compensate, the patient gets confused, and their skin becomes pale and cool. It's a picture that screams trouble.
The immediate goal is really simple. You have to refill the tank. It doesn't matter if the patient lost blood or if their blood vessels are just too leaky. The number one priority is to get fluid back into the system and get that blood pressure back up.
And believe me, the team moves like lightning on this. They'll get 2 large IV lines in, think of them as fire hoses, not garden hoses, to start pouring in fluids. And for a major trauma patient, they'll also give a drug called tranexamic acid, which basically gives the body's own clotting system a huge boost to help stop the bleeding.
So, once those immediate life-ending threats, the ABCs, are being managed, the assessment starts to broaden out. Now we're looking for other critical problems that need our attention.
Next up is D for disability. And that's just a quick way of asking, how's the brain doing? Clinicians use this simple scoring system called the Glasgow Coma Scale, or GCS, to check a patient's eye, verbal, and motor responses. It gives them a really fast snapshot of their neurological status.
Now, one of the very first things they'll do here is check the patient's blood sugar, because a low blood sugar is a super common reason for someone to be unconscious, and thankfully, it's an easy fix. If that's not it, they might give what's sometimes called a coma cocktail. It's not a drink, it's a set of IV drugs that can rapidly reverse some of the most common causes of a coma, like an opioid overdose.
And that brings us to our final letter, E for exposure. The logic here couldn't be simpler. You can't treat what you can't see.
The patient is completely undressed, so the team can do a full head-to-toe examination and make absolutely sure that no injuries have been missed.
But, and this is a big but, this step comes with a huge risk: hypothermia. For a major trauma patient, getting cold isn't just uncomfortable, it can kick off this absolutely lethal downward spiral they call the triad of death. You see, as the body gets cold, it can't form blood clots properly, which leads to more bleeding. That makes the blood more acidic, and the acidic blood makes it even harder to stay warm. It's a vicious, deadly cycle that the team works very hard to prevent. So let's just take a step back for a second. We've walked through A, B, C, D, and E. When you put it all together, what have we really learned? What's the secret sauce of this incredible system?
This sentence right here, this captures the entire philosophy. The ABCDE approach is not about getting a perfect diagnosis first. It's a system of action. You see a problem with the airway, you fix it. You find a problem with breathing, you fix it. You act on the problem that's right in front of you.
When it comes down to it, this approach is the ultimate troubleshooting checklist for the human body in crisis. It's what allows a medical team to walk into utter chaos and calmly, logically bring order to it, making sure the biggest threats are tackled first every single time. It gives every patient the best possible shot.
It's just a powerful reminder that sometimes the most brilliant solutions aren't some complex new technology, but a really well-designed, well-thought-out system. And it really makes you wonder, doesn't it? What other elegant, life-saving systems like this are out there, working all around us, just out of sight?